Hey everyone, Michael here. Welcome back to the Southern Indiana Sawmill channel. This is an update video for you all who have been following along with the cancer journey. For those of you that have not been in the loop and haven't been following along, just a very quick synopsis of what's been going on the last 10 months. I was diagnosed with a 1 in a million cancer called adrenocortical carcinoma. And at the time of my diagnosis, I was stage 4 metastatic, and it was determined to be an aggressively spreading cancer. As of the recording of this video, tomorrow I am getting on a plane with my lovely wife to go to Bethesda, Maryland, to the National Institute of Health to have abdominal surgery to remove my primary tumor and 2 smaller liver mets that have spread as a result of the metastatic nature of the cancer. Now, previous to setting up this surgery and going through all of this, I had been through 4 rounds of very intense chemotherapy called EDP and 2 rounds of a pill form of chemotherapy. And unfortunately, neither of those forms of chemotherapy seemed to stop the spread of the cancer in my body. Now, here's the thing, which is kind of a difficult conversation that we had with the surgeon, is that under ideal conditions, we would have been able to stop the spread of the cancer and either stop it or shrink it. And we weren't able to do that. And so the concern right now is not necessarily the surgery itself. The concern is what happens with the cancer that is still wanting to spread while I'm recovering from surgery. And so this surgery is not necessarily something that is being done with the intention to prolong life, but it may improve quality of life. And one of the other reasons that we're doing this is because it may open up other treatment options in the future. One of the conversations we had with our surgeon, one of the questions that he had was, is there any other systemic treatment options available? And at this point in time, there is not. So let me explain why we've run out of treatment options after only two really chemotherapy options. The cancer that I have presents itself in unique ways and differently in every person. Adrenocortical carcinoma is a very strange and very rare cancer. And sometimes this cancer will secrete steroids and hormones. In my case, this is exactly what it's doing. And it's doing it in fire hydrant gushing amounts. One of these chemicals is called aldosterone, and so I'm diagnosed with something called hyperaldosteronism. Say that 10 times fast. And the other one is very high levels of cortisol production, otherwise known as Cushing's syndrome. So these are 2 chemicals you probably don't think about too much. Cortisol specifically really helps control your muscle function, your body's ability to handle stress, wound healing, heart rate, all of these sorts of things. And so monitoring blood pressure has been a constant daily thing for about the last 10 months. And we've slowly been able to bring cortisol down. It's coming down to a point now rapidly with medication to where the doctors are confident they can perform the surgery and that I will recover well. But one of the reasons that these other treatment options have not become available to us yet is because of the high cortisol. We expect after the surgery to jump right into immunotherapy, which is very different from chemotherapy. Whereas chemotherapy tends to attack all of the cells in the body and goes after really the most aggressively spreading cells, which presumably is cancer. Immunotherapy actually works with the natural immune response of your body and finding and targeting specific cells that are destructive to your body and then getting rid of them. So the immunotherapy I'm going on, at least anecdotally, has been effective. With the type of cancer I have, there has not been a lot of significant research on it. And so based on science or on statistical evidence, the other treatments are more effective. But immunotherapy, at least anecdotally, has proven to be effective in many, many patients that have had this very specific type of cancer that I have. The good news about immunotherapy is it's not as destructive to your body's system as what chemotherapy is. And so in as little as 2 weeks after surgery, I'll be able to hop right into immunotherapy, which means that there won't be a big long gap in between treatments, and hopefully, Lord willing, we can contain this cancer in some form or fashion. Now, one of the tumors that I have that is the most concerning exists right in the mediastinum region. That's the area sort of in between your lungs. And it's been increasing in size, and it's pressing up against one of the 2 major arteries One of them, which is called the vena cava, it's pressing up against, and it's also pressing up against my esophagus. Now, at this point in time, it doesn't really affect me physically, functionally in any way. It's not restricted, it's not wrapping around, it's not invading, but it is pressing up against, it's leaning into it. And so if there was a surgery option in the future, if we could stop the tumor from growing, or Lord willing, even shrink it, then it would be a major reconstructive surgery possibly to remove that specific tumor. Believe it or not, the other ones that I have around my lungs, they are not necessarily concerned about removing. It's just the specific location of that one. So what about the abdominal surgery that I'm going to have? Thank you for asking. In the surgeon's words, this is a very aggressive surgery. He has performed it multiple times in other patients successfully. And so, again, it's not the surgery itself that we're necessarily worried about. It's what happens with the other cancer up here in the thoracic region while I'm recovering from the abdominal surgery. Now, the way the surgeon described this procedure is like a hamburger in a bun. So, if the cancer is a hamburger, we don't cut the hamburger, we cut the bun, we cut everything around it. And the reason is because this specific type of cancer and the aggressive nature of it, if you touch it at all, if you cut that cancer at all, you're going to cause cell division inside the body. And if that happens, it will spread aggressively, or it will go wild. And so in his words, this tumor to him is invisible. He does not even see it until it's removed out of the body. Now what that means is he has to cut everything around it. And so basically, for those of you that are squeamish or don't like to hear these things, you might want to skip ahead. But basically what he's going to do is he's going to start in the upper abdomen, as far as I understand it. It's going to be an open procedure because the tumor is 14 centimeters in size, or a little over 5.5 inches. And he's going to cut some vein, I don't know the name of it, up on the top of the abdomen. And then he's probably going to cut into the diaphragm and repair that, which he says, oh, is no big deal. And then probably cut all or part of the pancreas, and then remove part of the spleen. And then coming down, he's going to remove the adrenal gland and all or part of the kidney. Then he's going to move over and remove the two smaller little cancer spots that are in the liver. I am in excellent hands. He's an exceptionally skilled surgeon, and so I'm confident that he will go in and do this, and he's confident that he can do it. In his words, I'm going to do this surgery in such a way that this cancer never returns to this spot again. And that's exactly what you want to hear. But it is an extremely aggressive surgery. The expectation post-surgery is that I'm going to be in the ICU for about 3 days, and recovery until I can be let out of the hospital is expected to be about 2 weeks. So one of the really nice things about going through the National Institute of Health to have this surgery is, number one, I believe they have the best staff possibly in the world at treating this type of cancer. It is rare, and there's not a lot of people that know how to deal with it properly. Another thing is that the NIH is government funded, meaning taxpayer funded, meaning your tax dollars, my tax dollars, have went into funding research and operations that are life-saving, which means that pursuing this option, even though we have paid into it, in a sense, doesn't cost us anything. So in terms of insurance or out-of-pocket expenses, it doesn't cost me anything except for our food, lodging, and travel. That used to be covered until last February, when our government pulled funding for people that need to pursue operations. And so that's unfortunate, but thankfully we've been able to have all of those costs covered by our wonderful church family and friends in an unbelievable way. Another thing that's really cool about having this procedure done at the National Institute of Health is that once this tumor is removed, they're going to use the tissue samples and send them out to multiple places and within their own organization, and they will be able to examine and test and do all kinds of genomic sequencing and crazy, groundbreaking, leading edge scientific things to not only help other people with this form of cancer, but hopefully they will be able to find some sort of mutation or something to help me in treatment options in the future as well. So those are all things that are pretty neat in doing this procedure. Of course, our hope is for a speedy recovery and then hopefully immunotherapy will be effective in stopping or shrinking the other tumor growth and being able to prolong life or put us down a path for surgery later on down the road. Now, many of you that follow my channel know that I always have faith-based content towards the end of my videos, and I'm not going to prolong this too much, other than to say that I do believe that faith is a gift, that it is given. It's something that we possess, but it's also something that possesses us. Faith from the Almighty cannot be explained. It's part of redeemed nature. And if you are not in the Lord, you would not understand it. But if you are, then you understand it full well. The Lord always meets us in our time of need, and I've been able to persevere thus far. I've had some extremely lows, and I've had some good highs, you know, in relatively speaking. Someone asks me how I'm doing. I say, you know what, all things considered, I'm still very blessed. And that is very true. One of the reasons we're pursuing this surgery and going down this path is because I don't think there's any way I could look my kids in the eye. I have 4 kids, ages 13 to 8. I don't think there's any way that I could look at them and not tell them that Daddy didn't try everything he possibly could for them to be here to be able to raise them. You know, quite honestly, I've had the conversation many times with my wife. If I was older, if the kids were raised, the fight might look a little different. But at this stage in life, I feel a need to continue to take risk and to see where this road might go. There are some people, once diagnosed with this cancer, stage 4 metastatic, they don't make it past 2 years. But there are some who are here 9 years, 10 years, 15 years later that have battled this stage 4 adrenocortical carcinoma and are still here. Lord willing, I may be one of those people. One of the things that I have going for me is that previous to being diagnosed with this cancer, I was extremely healthy. I remain in good health, even after chemotherapy, which is supposed to destroy your heart and do all kinds of terrible things. My blood work, all things considered, is in excellent condition. And so I have just about everything going for me going into surgery that you can have. So all of these are very hopeful things. In the meantime, we pray that the other cancer does not spread and cause problems. But, you know, we are going to be in the Lord's will regardless. And we are going to have faith. And we pray that He will allow me to persevere. And we pray that He will be merciful and give me more time to raise my family and to be an influence in their lives. This will be the only video that's coming out this month for obvious reasons. Tomorrow I get on the plane as of the recording of this video, and then I will have surgery and I will be out for almost 3 weeks. And so I will be bringing an update post-surgery to let you all know how things have gone, how I'm recovering, how I'm feeling, and we will take it from there. One of the things that I've been told again and again and again in the journey of dealing with cancer is that you have to take it one day at a time. Do not let the anxiety of the future worry you. Do not get bound up with fear, but be thankful for every day that you have and make the most of every day. And that is what I've been doing, and that is what I intend to keep doing. So guys, thank you very much for watching. God bless you all. Wish me well, pray for me. And until next time, we'll see you. Take care.